Welcome to Psych Incubator, an Eminent Psychotherapist Revealed. Along with my co-host, Dr. Jennifer Kelly, we are going to be interviewing Dr. Jeffery Smith, who we're pleased to feature tonight. He's internationally known for integrating the teaching of psychotherapy by tying diverse therapies to their universal roots in basic science. Jeffery is clinical professor of psychiatry at the New York Medical College, president of the Society for Psychotherapy Integration, leader of the American Psychiatric Association Psychotherapy Caucus. He is currently organizing CEPI's October 25th conference that we hope you all will come to Istanbul to attend. Dr. Smith is a clinician and teacher and has focused his work on helping early career therapists make sense of what is happening and what to do next through practical understanding, not only of change processes, but of how the art of psychotherapy is tied to the underlying science. He maintains a private practice in Scarsdale, New York, and publishes bi-weekly essays on psychotherapy at howtherapyworks.com. He is the author of Psychotherapy, a Practical Guide, one of the few textbooks of psychotherapy compatible with all contemporary approaches to therapy. His 25-episode podcast, How Therapy Works, parallels the textbook with questions and discussion. He has published articles on therapeutic action and modernizing the conceptual framework underlying psychotherapy. So welcome, Dr. Smith, to Eminent Psychotherapists Revealed, and welcome to our viewers.
Well, thanks very much, Jeffrey.
Yeah, thank you so much, Dr. Smith, for spending time with us this evening. We really appreciate it. And I'm going to get started by just taking a dive in here. And I know that you've spent a tremendous amount of your time and your career, at least recently, focusing on modernizing psychotherapy, and especially in particular, the infrastructure principles of psychotherapy. Can you tell us more about that?
Yes, certainly I'd love to. That's exactly what I'm interested in. When psychotherapy was invented, nobody really knew anything about how the brain worked, how the mind works. It was all kind of mysterious, and so they did their best to figure out some way of making sense of it. And everybody came up with a different theory, and they were all just fine as far as they went. But none of those was really tied to any kind of basic scientific underpinnings. And so unlike other sciences, ours progressed without really having the infrastructure in place. And recently, a lot of discoveries have made it much more clear what might be going on. And so psychotherapy stays in this fragmented state, and that's confusing because clients don't know what kind of a therapist they need, and trainees have to make a decision about, well, I'm going to be a disciple of this therapy or that, and they don't have any basis for making those decisions. So it just creates a whole lot of confusion and extra complexity. In the American Psychiatric Association, psychiatrists are supposed to learn 3 different therapies. Well, they're lucky if they learn one of them halfway well. And so we really have a problem. And what I've been interested in for quite a long time now is that if you understand some of the basic scientific principles, then the whole thing kind of makes sense. And so I hope in the course of this time that I can give you a flavor for how that works.
Yes,
but the idea, yeah, go ahead.
So why don't you introduce us to some of the principles that
Right.
you believe that are essential to functioning effectively as a psychotherapist?
Okay. Well, one big question that as far as I can tell, practically nobody has asked is, what does psychotherapy treat? Because people will tell you, oh, it treats DSM disorders and this and that, but that's not really what psychotherapy is about. Psychotherapy works to help people's change how the mind works. And it turns out that well, let me step back a little bit. So in looking at that question, what comes clear is that human beings have problems, have emotional problems the kind that psychotherapy can address, because evolution set us up with a part of our mind which operates mostly unconsciously, and that's there for our protection, and it works in ways that are very similar to your dog. When you get too close to your dog's dish, it'll growl and you know, okay, I better back off a little bit. That's a good, healthy communication. And that part of our mind is not really accessible to our consciousness, at least when it gets stuck. And so the problems that psychotherapy treats are problems where the inner non-conscious protective mind comes up with a solution to a serious problem, like it might be a problem of not getting the kind of support and love you need when you're a little kid. Or it might be a trauma, or maybe it's something like people who have extra anxiety that goes back in evolution to a solution that was evolutionarily made sense, but it doesn't make sense for humans. And these solutions become outdated. Maybe because they appeared first when we were little kids and we didn't have the resources to do better. Or maybe it's a solution of just avoiding something instead of facing it, that we can do better as adults. And so a group of us at CEPI came up with a definition of the problems that psychotherapy treats. And that is, we call them entrenched maladaptive patterns. And it just means that patterns that are not easy to change, because otherwise people would just change them. They'd read a self-help book and they'd get the idea and they'd be fine. They're entrenched, they're maladaptive in the sense that now they're outdated and they're not working the way they should, and there's something better we can do. And they're patterns, meaning that there's a good possibility that they might get repeated. So it's worth doing something to take care of those things. So we call them EMPs, entrenched maladaptive patterns. And it turns out that those are exactly all the things that psychotherapy aims to treat. Now, psychotherapy does produce some other positive effects like changing genetics, epigenetics, and sometimes neuron growth and things like that. But that's not what shapes the technique of psychotherapy. So it's not really important for teaching. So basically, then evolution has given us a mind that often enough comes up with solutions to problems that aren't as good as others, and psychotherapy. So then we get to the second thing about psychotherapy, which is, what does it do? Well, psychotherapy helps clients to trade their old maladaptive patterns for healthier ones, for ones that are more satisfactory. It's that simple. So, and then once we do that, then it turns out that there's a lot of science now. Once evolution tells us kind of how we get into trouble, there's a lot of science about how these patterns are produced in the mind. And it turns out that research, for example, on fear, on learned fear, tells us a lot about how the mind identifies a scary situation and how it comes up with a response to that. And so now we know about the location that fear signals come out of the amygdala, where the alarm signal gets sounded. And we know that there's some deep down logic that is a different kind of logic than we use every day. It's logic that's really by pattern recognition. It's associative logic. And that logic is what our mind uses to identify something that could be dangerous. And that all happens automatically down there outside of consciousness. And so that's appraisal. That's the part of logic that decides that something's got to be done. There's a problem. Then there's another piece of logic that comes on the other side of the alarm signal, which is, okay, what are we going to do about it? And those two pieces of logic, some people call them schemas, some people call them implicit learning, but it's a little bit of primitive logic, the same that the dog uses when you get too close to his dish. And that logic is what we want to change in psychotherapy, and what psychotherapy is designed to change. So once we have that, so now we've got two big steps. We've got why people have trouble and what kind of trouble they have. We have where the trouble is located and how it works. And so now we can ask the question of, well, how do we change it? And it turns out that there are only three basic fundamental change principles, change mechanisms. And, here I'm not talking about what are called moderators. Moderators are things like having a good therapeutic relationship is a moderator of effective therapy. But change mechanisms are really down at the nitty-gritty of how are we going to change that logic so that either the mind says, oh, I used to think this was a dangerous situation, but now I know it's really okay. The war is over and I don't have to react. That's one kind of change. And the other kind of change is to say, wow, yes, instead of of hiding and stuttering when I'm trying to ask for a raise, I could just stand up and ask for the raise. That's one where we want the mind to come up with a different solution with a new response pattern compared to the old one. And so that's changing that other part of logic that we want to do. Okay, what are the three change processes that operate in psychotherapy? And you can see I'm making it pretty simple here. So one of them is new learning. And that works just like what's familiar to us, like you learn a new stroke in tennis, and you learn it by first listening and watching and then practicing. And what does that new learning do? What's the role of that in psychotherapy? It's a really important thing because people sometimes people have a repertoire of different ways of responding to things. And so we want to add to their repertoire something new if they don't have it in the first place. One place where this is really, really important is in arrested development. How much do you folks see of people with arrested development?
Almost everybody that comes into
Almost
my
every, right.
in
Okay.
some way, right? There's some part of them
Yeah,
has stuck in developmental time.
that's right. But development, I always smile when I see there's arrested development here. I smile because that's easy to fix. All we need to do is to go through the same kinds of experiences that maybe other people went through a long time ago, but it doesn't matter. You can still learn those things. So new
Or are these called
learning,
the corrective emotional experiences? Would you call them that?
I just call this, I'll get to that in just a minute, but I would call this is just enhancing and expanding your repertoire of possible responses. Because if you haven't practiced something, then I can tell you this would be good to do, but you're not going to do it because it's
Exactly.
unfamiliar. Okay, that's number one. Um, the second mechanism of change is called extinction, and that was first observed by Pavlov a long, long time ago. And it turns out that extinction involves learning in the cortex that then sends inhibitory signals into the place where those maladaptive patterns are generated. So you don't see, maybe it's a veteran who, when he hears a loud noise, thinks it's a gunshot, and all of a sudden, he's reaching for his gun and everything. And and if that person experiences the trigger and begins to understand that no, the war is over, you're back home, it's not going to happen, it's okay, pretty soon the response disappears. And that's because that's what's done in at least what exposure thinks it does, is exposure therapy, is to extinguish the response. The problem with exposure therapy, or at least with extinction, is that the amygdala is still sending out those alarm signals. It's still saying,
Mhm.
uh-oh, there's a danger here.
Right.
And so pretty soon the old response comes back.
Mhm.
So extinction tends to be temporary. And then there's what I think of as the queen of change processes, and that's called memory reconsolidation. Is that familiar to you?
Bruce Ecker.
Yeah, that's Bruce Ecker, exactly. He has been the champion of that. And Richard Lane is also a CEPI member and a psychiatrist at the University of Arizona who's done a lot of work on memory
I
reconsolidation.
think, and I think that's a powerful paradigm. And I think different different pioneering people use different language. Like
Hmm.
Abby
Hmm.
Davenport talked about unlocking the unconscious, which is a
Right.
similar
Yes.
phenomena.
Because it happens all the time and it's had many different names. And that's where we get to the corrective emotional experience. And so now that we've been able to focus in on the basics of what's going on and how it and what we want to change, then we can look at, so what do you have to do to make memory reconsolidation happen? And that turns out to be pretty simple also. There's two things, and they have to happen at the same time, roughly. One is the old pattern needs to be activated. Well, how do we know that the old pattern is activated? Happened today in a session today in my office. Somebody all of a sudden got teary, and she got teary when she was thinking about being rejected and being all alone and that feeling of abandonment. And so that's how I could tell that the thing that triggered her responses, her maladaptive responses, is that there's the fear of being all alone, of being rejected. And that made her want to go back to what was comfortable, the old, ugly, maladaptive stuff that used to go on in
Familiar,
her family.
maybe not
Yeah,
comfortable, maybe familiar.
that's familiar. That's
Or
right.
that's safe in their
That's
mind.
safe.
Safe.
That's right.
Right.
Because if you do all the old stuff, then you know you're going to be accepted and nobody's going to throw you out. So affect is what tells us that the old pattern is activated.
So
Because
in other words, you're lighting up the neural networks,
that's right.
and
Exactly.
until they're lit up, you can't really discharge
A
transform it.
transformation is not going to
Now
happen.
Bruce Ecker says that, and I don't know how you feel about this, but he says that the opening only lasts a certain time, and that's why a lot of times in therapy you feel like you've done some good work, and it closes back up again, and the person's back in the same seat in the same spot the following session. What's your idea about opening up? How long it needs to stay open to be able to
Mhm.
reconsolidate the memory?
Well, that's true, but I think that one can um, put the pieces together in a slightly more complex way, and it doesn't all necessarily have to happen in the office. But ideally, yes. Let me talk about the second thing that we need to do at the same time, and that is to deliver um, disconfirming new information. Now, when I say information, people have said to me, "Well, what about emotion?"
That is
I say,
information.
well, wait a minute, emotion is information too.
Exactly.
That
Yeah.
inner mind is uses all kinds of information, and it might be the tone of voice or the soft pillows in the
That's the
office.
most powerful information source for human.
That's absolutely, absolutely. And so delivering that disconfirming information, and the information might be that, hey, the war is over, the danger is gone, it's okay now. Or the information might be, you might want to try talking back, having a discussion with your boss instead of just saying, yes, 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 I'll do it. You might want to try pushing a little bit. One patient of mine uh, was a little bit like that, and she came in one day and she said, you know what? I joined a boxing club because she needs that bodily sensation. The body gives information
Somatic,
too.
that somatic sensation.
That's right. And her feeling of landing a punch tells her that it's okay to be powerful.
Yes.
So that's information too. That's
Yeah,
disconfirming
exactly.
information. I saw somebody recently where we had one of those situations where you see a transformation in the course of a few minutes, and it took years to get there, but that few minutes changed this person for good, permanently. And that's what memory reconsolidation can do. How did that happen? Well, he was he was blaming himself for a lot of bad stuff he'd done as an adult. And we clarified that the reason he did all those bad things was in response to trauma when he was a kid that left him with a tremendous sense of shame. And so once we could establish, at least intellectually, that this was forgivable, this was not his fault, Then he went home and he discovered some documents that that had to do with a person that he admired a lot. And those documents told him that this person he admired as a person who knew how to live his life had actually not been that all his life. He'd done some pretty bad things himself, but managed to get past them and to forgive himself. And that gave my client a pathway for forgiving himself. And so having kind of preloaded with that, he came into one session and told me about trauma that I already knew about, but an aspect of that trauma that he'd never revealed, which is that the sexual abuse that he, at the moment that that happened, he actually wanted to be close to this person because the person promised to be his friend and was very warm, and nobody else in his life was warm like that. And so when it turned into something sexual, it didn't hurt. It was a little confusing, but he felt intensely responsible and ashamed for having participated in that, as if he had made it happen.
Yeah.
And that plagued him for his life up until this session. And so all of a sudden what we could see is, as soon as he told me what was really the core of his shame, it evaporated. It was gone. And so that was a situation where the disconfirming information was gradually gathered over time. He was ready for forgiveness. He was ready to let go of the shame, and then activated the old pattern as he told me about his feelings, and click, bang, there it went. So it doesn't happen in every session with every person, but that's an example where there is no other explanation for that other than memory reconsolidation. So anyway, now we've gotten from evolution to fear and fear responses to how do you make change happen, and these three change mechanisms. And that pretty much sums up the infrastructure that applies to all of psychotherapy. And if you think about different therapies, how do they activate the old pattern? Well, maybe it's a 2-chair exercise if you're doing Gestalt therapy, or transference when you just have an intense relationship over time. Then people begin to feel things and they can't help it.
Yeah.
Or verbal exploration does it, and exposure therapy does it. So all these different techniques actually do the same thing, and every psychotherapy wants to deliver new information. Now, if you'll let me go on, I'd love to talk about the art of psychotherapy.
Yeah, because I'm sitting here listening, and and you presented, in such a succinct manner, but when you really dig into it, you can just really see the complexity
Yes.
of
Yes.
psychotherapy.
Yes.
And it was like, I'm not convinced that there's enough time or they're spending enough time in the teaching in today's world to really give this to the students. And so
Yes.
this is important information, when you
Mm-hmm.
start talking about what psychotherapy is,
Mm-hmm. Mm-hmm.
and I don't see that happening. At least no one
Mm-hmm.
comes to me,
Mm-hmm.
that have this kind of in-depth knowledge and insight
Mm-hmm.
about psychotherapy. So
Yes.
I'm
Well,
all ears.
so let me talk about that, and then if you'll ask me about the art of psychotherapy,
Yes.
I want to do that.
We will.
But okay. So what we're doing in this pilot program that I'm doing with psychiatric residents is we have 2 hours of didactic. I mean, 2 hours of practicum after the hour of didactic, and the hour is pretty much what I just told you. In the practicum, we teach the residents to ask 5 questions, and not just ask the questions once, but to make it their business to seek the answers to these 5 questions. And so I'll tell you what they are, because this is a way of doing 2 things. First, it simplifies the practice and the learning of psychotherapy, but it also does it in a method that let's see, what's the name? It's called problem-based learning. Is that familiar to you?
No.
Problem-based learning means that you expose the person to a question or a problem that they're going to be curious about. They're going to want to find out on their own what's the answer to this, or how to understand it. And so by giving them these questions to ask, we're encouraging people to dig into things that are going to require some extra knowledge. So let me give you an example. So the first question is, what is the entrenched maladaptive pattern we're dealing with right now? And sometimes people have more than one. That's another part of it. But what exactly is the maladaptive pattern that we see? Well, maybe it's compensating for the shameful feelings I have deep down by being an overperformer. That's an example, and so we want the student not just to look at what's the distress that the person brought into the office, but what is the pattern of experience or behavior that's causing that distress. And that's the thing that we're going to want to change. We're going to want to trade that for a better one.
Yes.
So that's the first question. And, it takes some practice to do that, to go from the initial presenting complaint to what's actually going on that's causing this. And I think a lot of times therapists really neglect to dig into that. So that's the first one. The second question is a very interesting one. We say, we want you to find out what is the dread that is triggering this pattern. And that goes back to the appraisal part, right? And so like with the example I gave you of the woman the tears came when she was talking about abandonment, that was her dread. It was the thing that her inner mind is afraid of encountering. Now, we think of this as emotion, but it isn't conscious. Sometimes we get some conscious awareness of what it must be, but strictly speaking, in that part of the mind, in the amygdala, nobody knows what feelings feel like in the amygdala. We just know how people react to them. And so we call those unconscious emotion. And there's a good deal of research and literature on unconscious emotion. Unconscious emotion is the same thing as the alarm signal that leads to what is the response that we're going to have to produce here. It's that neural activation that goes from the amygdala to some other subcortical structures. Okay, so the second question is, what is the dread? And I've seen that. I have a guy in treatment right now that the most powerful moment in this treatment, which has just been a few months, powerful moment was when I said, well, what is it that your mind what is the dread down there? And he had no idea. But all of a sudden, just the word got something going. You could see there was some affect. So the work is now getting through all the layers of protection so we can find out what really is the dread there. Anyway, that's the second question. And so we're digging, by asking that question, we're digging right into the subcortical structures in the brain to where this logic is taking place, that on those two spots that we want to
Is that
change.
like a limbic system probe?
Absolutely. That's a good way to say it. Yep. The third question is, we say to these young therapists, okay, what is your working hypothesis about how this came to be and what's triggering it?
Yes.
And so it's a good thing to be
Case
thinking about
formulation.
it.
Yep.
Yes, but it's a very practical kind of formulation. It's not the academic kind of thing that you read about sometimes. And we emphasize that this is a guess. At the very best, it's something, and if it turns out to be wrong, that's great, because you're going to learn something even more interesting. So the fourth question then is what is the rule that the mind is using? Because we're talking about this kind of pattern matching and associative logic. So the mind is saying, if this kind of danger, then this is what we do, so I better
Withdrawal
prevent
is humiliating.
Exactly. And so that refers to the second part of logic that I mentioned before. So we got those two spots of logic, those two pieces of logic that we want to change. We're nailing them both. And the last question is, what is the antidote? And I use that word to describe that disconfirming new information that we want to deliver.
Mhm.
And
So
so
that's the memory reconsolidation part.
Mhm.
it's
Dro-
about
Dropping in
memory
the new,
right,
dropping in the new code. I call it the
right.
deep code, and then
Hmm.
coming up with a more adaptive current code that you're going to drop right.
Exactly. So everybody has a different language for it, but you can see then, and so what we do is we give them a couple of examples in the first experiential hour, and then the students actually came up with their own idea for the second hour. They wanted to do a role play where one of the residents pretends that they're a patient, and they asked me to do an interview. And because I think trainees are very often really eager to see,
How
experienced
it
people.
works. Yeah.
Mhm. Right.
Yeah. And so we teach them about how to how to pursue those questions. So those 5 questions give us a very simple but remarkably
Yeah.
sophisticated
Makes a lot
way
of sense. Yes.
to teach how to do this.
You've really
Right.
distilled from a lot of literature
Hmm.
some of the core elements of
Hmm.
psychotherapeutics. We have a question from Ken. I wonder if you have found that internal family systems provide user-friendly language for your patients. For example, entrenched maladaptive patterns are considered to be misguided, out-of-date protectors. Thank you, Ken.
Absolutely. Yes. Ken, thank you so much. If you look over there, you see some on my shelf behind me, there's some stuffed animals. I don't do child therapy, but I do see people and have since for many years now, for well, 40 years, I've been working with people with dissociative identity disorder who
Mhm.
absolutely have different parts to themselves. And
Mhm.
even though you're working with a whole, you still need to have a relationship with the different parts. And so that taught me a lot about inner selves and how they're different and how they have their own ways of thinking and how to relate to them. And so I also think that there's another piece of science that's helpful in this besides internal family systems, and that is, if you remember the thinking fast and thinking slow.
Yes,
Um,
Kahneman.
right, and cognitive therapists or cognitive scientists have been studying 2 parts of the mind: the thinking fast part that's
Yes,
not conscious and that operates automatically, and the conscious logical
or
part.
deliberate slow processing part.
Yes, and I'd love to talk to some of those people because I think I have an answer to their biggest question. They have an argument in that field about are there really 2 distinct parts of the mind, or are they really more mixed in together and not distinct? The answer is this, is that when people are functioning in a healthy way, then there's a smooth partnership between consciousness and the unconscious mind. They're working together and they both contribute a great deal. When there's a problem, it's because the inner mind has gotten stuck. The thinking fast part of the mind has gotten frozen in time with some outdated response pattern, and that separates it from conscious thinking and makes 2 separate minds. And so IFS is very accurate in recognizing that when there is pathology, when there are problems, that yes, those it is very valuable to think of different parts of a person. And so I talk a lot about inner minds and inner selves, the little kid inside, the non-conscious protector, and so on. And I like the language of IFS too.
Yes,
Uh, Very, very helpful.
thank
So I think that's super important. Ask me about the art of psychotherapy.
Tell us about the art of psychotherapy.
Okay, thank you. I've been waiting for that. So here's the thing.
You primed my neural network to ask you the question. Oh, didn't
Okay,
pick it
all right.
up.
However we got to do it, I don't care. As long as we can
We're
do it.
ready. Yeah, we're ready to
Okay.
take a deep
Okay. Here's the
dive.
thing. Where does that logic that I mentioned that we want to change, where does that take place? In the limbic system, as you said, Jeffrey, right?
Hmm.
Okay. How do you communicate with the limbic system? That's the art
Somatically.
of that's
Somatically.
the yes, that's the art of psychotherapy. And I'll give you my favorite example. If you're in the United States and you watch a drug ad on television, then the ad um, is going to be full of bright colors and
Right.
music and
Right.
sexy people and they're relating to each other and they've got big smiles on their face and they're just having a ball and they know this drug is such a great thing. This oh my gosh, I can't imagine anything better. That is pure limbic communication. It's purely designed to reach down into the subcortical non-conscious part of the mind
Yes.
and convey, because that's where
And
our
isn't that what
motivation.
politicians do? I mean, politicians,
Absolutely.
they
That's right.
activate your anger circuits and then they get you
That's right.
afraid and then you follow them.
Right. And then on that drug ad, this is why drug ads are such a good example. They also tell you about the fact that this drug could kill you and it has a bunch of bad side effects and so on. But how do they express that? They use language
Right.
that's not going to get down
Right.
to the limbic system.
Right.
That's right. They use language that is calculated and a tone of voice and everything that's calculated
That's
to
right.
avoid so that it won't touch your decision making. It's
So
you're
you're
just going
so
to hear it. It'll.
what you're talking about is emotional learning that
That's right.
that high impact learning is
Yeah.
emotional.
Yes.
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 And absolutely. And so once we recognize that, then we know how do you teach a new therapist to do emotional learning, to communicate in this mode? Well, the best way to do it is to say, just relax and do whatever comes to mind and do what you feel like. Be a person, be yourself. And so it's when we allow our intuition. So I tell people, curiosity is okay. As a therapist, you can let your curiosity um, uh, tell you what it is you don't know and what you'd like to know.
I
And
think it's actually more than okay. I think it's one of the critical factors of
absolutely,
psychotherapy, being curious.
that's absolutely right. And the more you understand, the more you're going to feel empathy. I like to use the word accurate empathy because that means not just like two people on bar stools and one of them says, I'm feeling bad, and the other says, gee, I'm sorry you're feeling bad. That's that's not accurate empathy. Accurate empathy is when you really know enough about the context of the person's feelings so you can feel it yourself. And
Right.
so empathy and intuition is we learn by trying things out, and eventually you find some things don't work and maybe it says more about you than it says about the other
It's
person, but
like a goodness
gradually,
of fit. We have to find
yeah,
it's like a goodness,
that's
and
right.
always trying to work that. Like, does it fit?
Right.
Does it match? Does it
Right.
work for you? Yeah.
Right. So the bottom line, I'm not saying anything that isn't part of the lore of psychotherapy, but what I am saying that's different is it's based on simple, clear, well-known science that if you're going to communicate with those limbic structures, you
Right.
better do it in a way that they can receive
Yes.
and understand.
Makes a lot of sense.
Right. So when I hear you talk about the art of psychotherapy, in my mind, I'm thinking it's the art and science of psychotherapy,
Exactly. Yes.
because of
Yes.
the science, you can put
Hmm.
the science is telling you this.
Well,
And-
now I'm gonna add one more piece to this. Um,
okay.
okay, you remember I said entrenched maladaptive patterns that because they're not that easy, change is not that easy.
Right.
Well, the neat part of all of this is that what pretty much every therapy is familiar with. Some of them call it resistance. Resistance is a phenomenon. It's not voluntary, it's involuntary. Well, why does that happen? If we think about it, those entrenched maladaptive patterns are solutions to a problem.
That's right.
They're solutions to a serious problem.
Well,
And
all
so
problem maybe.
and it's an old one. And so
Yeah.
we come, where our client comes to us and says, you know, I have this problem. And we say, oh, hey, that's great. I'm going to take that away from you. And I'm going to give you something that you've never heard of before. And the inner mind says, you know, that's a threat. That's very dangerous. And so what does the inner mind do when it perceives a threat? It comes out with a response. And the response is, oh, doc, you know, I think I'm okay. You know, I'll see you later, or something like that. So the resistance to progress in therapy is also made up of entrenched maladaptive patterns. And the things that we know in order to help people with those are the same for reluctance, resistance to change. So now we have one set of change mechanisms that we can apply not only to the problem that brought the person to therapy, but also to the difficulties that come up in the course of the therapy. And so it simplifies things. And I'll add one more piece to that, which is now we understand why we have common factors, because you know that there's a lot of talk about common factors that have been demonstrated over and over again to be um, to be
Healing.
um, to be healing. Well, to have a what's a correlation with success in therapy.
Right, they account
But
for a large portion of the outcome, the variance.
absolutely, but there isn't very much to tell it to explain why they work. And the explanation is that in that the person is going to be skittish about making the changes that you want to see in psychotherapy. They're going to be afraid of
Mhm.
trying out new behaviors or new patterns of thinking. And so we need to establish a lot of trust in order to help the person do something that's scary. Think about when a little kid gets on the school bus for the first time. You know, what do? Well, they need to have a lot of trust in their mom and or whoever is taking them to the bus. And when they feel safe, that okay, I'll do it. I'll see you later, mom. I'll be okay. And they make that leap. We're doing the same thing with our clients. We're asking them to do things that are scary. And that's why we need a strong relationship, especially with a lot of trust in it.
So
And
I ask almost every one of our guests this, but do you think that psychotherapists are born or are they can they be made?
I suppose there's some of both, but I think there's an awful lot more of the making than we make use of. And I think,
Yeah, I would
you know,
agree with
most people who sign up to do this do it because they've got the wherewithal to be good therapists. And so I'd rather, you know, just like with our clients, you know, there's a lot of biological input to their problems. Maybe they have a predilection to depression or anxiety or something like that. We can't change that, and we don't try to change it, but we do try to change the things that we can
you.
change. And so the same thing with therapists. So yes, there is a problem. There's here and there. There are people who are doing it for the wrong reasons or uh, don't have
Or
the
conditioning.
capacities. Yeah, and
Well,
so
I kind of think about it as the hardware and the software that we all have
hmm
hardware, temperament, and all that, and natural capacities, and
hmm
then there's our software that we
hmm
cannot create our software with the kind of
yeah,
training you're providing.
that's
That's
good.
right.
You know, one of the things that we physicians have a hard time with is we tend to focus. You know, all of medicine is focused on the negative, on things that are
Yes.
wrong. And I think I've had to learn to remember how important it is to talk about people's strengths because those
Right.
new solutions to problems are going to come out of their strengths. You know, if we run into a problem, the first thing I'm going to ask is, well, have you ever had been successful in dealing with something that's similar to this? And
Yes.
can we take a pattern that you already have and modify it a little bit so it's going to help you in this situation? You can't tell whether I'm a psychodynamically oriented or a behavioral therapist, right? Because I don't make a difference between them. Um, this, I said a little bit before we started that how did I get into this? Well, um, a long time ago, my director of training, where I was volunteering in teaching at New York Medical College, said, "How would you like to teach a course on combining psychodynamic and behavioral therapies?" And I thought about that and I said, "Gee,
Ah,
that sounds like a good idea. I'd
It
love
was a
to
little
do
like
that."
Willard and Dollard's book.
That's right,
yeah,
because that's what I do anyway.
right.
And so I did, and that started me on really thinking about change mechanisms and always trying to work on how to teach it, how to make it make sense for people. And so that went on for a while, and I started to build a handout for that course, and eventually the handout became a book, and so on. And but I had done a lot of thinking about these principles before I learned about memory reconsolidation. And so back in 2015, I came to a conference and somebody talked about that, and I said, "Wow, that explains all of this transformative change that I've been thinking about." Um, I also I had a blog that I did for consumers basically in 2010. And what happened was I started to talk about, I did one thing in response to somebody's question about people who have a very strong attachment to their therapist. They feel like if I didn't have this person, I wouldn't be able to survive.
Right.
And that brought in a lot of, it became the go-to place for people with those kinds of problems. And I wound up with a book on Amazon about that, about attachment to your therapist. But in the course of doing it, people wrote in about the therapeutic disasters that they had. And they'd finally admit to their therapist that I have this intense attachment to you. And in 10 minutes, the security guard came and threw them out of the clinic and said, "Never come back again." Things like that that were just unconscionable. And so that's what got me to the thought that I think a lot of therapists could use some help. And
Oh,
I
yes.
and how to deliver something that's useful that you can remember while you're sitting in the office working with somebody.
So can
And
I back up a bit?
do.
What got you into psychiatry and psychotherapy? Tell us about the origin story.
Okay. Well, first of all, I've always wanted to know how things work. One of my earliest
Physical,
memories,
the mind, or
anything. What
anything? Okay.
earliest memory is one of the little girls in the neighborhood could ride her tricycle really fast. So I was too young to ride a tricycle. But I wondered, were the pedals going up and down like this, or were they going around like this? And so I was already kind of, observing
Mhm.
and thinking. Um, but I went to Stanford, and as a freshman, we had a lecture by a Swiss psychiatrist named Paul Tournier. And you know how undergraduates are, they asked him all kinds of difficult questions. And what he would do with those questions was he went right exactly to what was behind the question, what the person really was eating at them, what they wanted
Mhm.
to know. And he was so good at that. And I said, I really was impressed with that. So then a few months later, I was thinking about I was going to be an English major, and I began to realize what that would actually mean. It would mean writing obscure articles about obscure authors in obscure journals. Uh, I didn't want that at all. So it took me about 20 minutes to realize that what I wanted to do was be a therapist. So then I had to decide, as was I going to learn statistics, or was I going to learn anatomy? And
Anatomy.
I decided anatomy was more interesting. So that got me, and then so 3 more years of college, 4 years of medical school,
Where'd
and
you go to
four
medical
years.
school?
Yes, I did at
Where?
UCLA. At
UC.
UCLA, yeah.
Mhm.
I
Okay.
lived a couple of miles from where the fires are, and used to go to the beach
Oh, well.
very near those fires. And then I looked for residencies, and they were a little kooky out west. So the further east I got, the better they were. And I wound up at Albert Einstein in the Bronx. And
Oh.
but I just wanted to be a therapist from freshman college.
So I have a question then. So tell me about your thoughts about psychotropic medications and
Mhm.
how you fit that in with therapy and the thought process
Um,
about
you
that.
know, somebody in our caucus, David Mintz, has written a book about that, and that's
We
very
interviewed
popular.
him. We've
Yes,
interviewed him. If you all
Yeah.
want to watch it, it's a great interview.
Good,
yes.
yeah. So I follow similar principles as that.
Mhm.
You know, when I use medication, I'm thinking about the psychological effects and what's that doing, and I'm thinking about the chemical effects at the same time. In the case of what David points out is in the case of antidepressants, about 20% of their action is chemical and about 80% is psychological. So I think of them as sort of like magic potions that actually do something some of the time.
Uh-huh. Interesting.
That is interesting.
Um, but so yes, I do medication. I do use medication, and when it's needed, and I think about it, um, and but I see it from those 2 points of view at the same time.
Mhm. So what would you suggest to people who are early in their career wanting to learn how to be a psychotherapist? What is there a trajectory that you think that they should aim toward, or what's your advice for early
Um,
career
y-
psychotherapists?
well, I really want them to learn the things that I've been talking about, and for that reason, I'm now working on. I have a book contract. It's going to be called "How Psychotherapy Works: Navigating the Therapeutic Space with Confidence."
Cool.
And it's going to present a lot of this. And
Mhm.
I'd love them to follow some of my materials and things so that you have a kind of a core conceptual model in your mind, and you can visualize where things are going on, what's going on inside that non-conscious part of the mind. Then, how do people learn? I think watching. I learned the most about interviewing from watching a senior
Yes.
clinician, and he was just wonderful and taught me so much. I've learned a lot from my clients. Um, um, I've learned a lot because um, there's of two things that I would say that I carry all of the time. Um, so one is that I'm more interested in what I don't know than what I do know. So I'm always asking myself, what is it that I don't know about this situation?
Great.
And the other one that goes with that is I always have a working hypothesis. When I finish an initial interview, I've got some idea. It may not be correct and it may be tentative, but I've got some kind of an idea. Why? Because that makes me a better observer. And it's the same thing with what you don't know. It means you're
Mhm.
you're really watching for things. You're watching for evidence about whether your hypothesis is right or not. So I would certainly say that to somebody early in their career who's learning.
Good.
And then, the art of psychotherapy is really being a human being. And I think that, sadly, psychotherapy is often presented as more of an intellectual kind of thing, and
Or
it's
technical, like a
more
technician,
technical.
as
Yeah,
opposed
that's
to,
right.
yes.
Yeah.
So who would you say were some of the pioneers in the field that influenced you in your theoretical and your clinical development? Like, if you were to pick out a couple of people that whose work
Yeah.
really stuck to your ribs,
Yeah.
who would you?
Well, here's what happened. In my second year, or late in my first year out of residency, I saw a person who had been badly traumatized in early life, and I knew she was a little bit dissociative. But I didn't find out for a couple more years that she had just classic dissociative identity disorder, and at that time there wasn't any literature because no respectable journal would publish anything about that.
Right.
So, so she and I learned together. But also in my residency, nobody taught me anything about trauma. That was for military psychiatrists at the time.
Yes.
And so where was I going to find something about trauma? Well, I had over on my shelf there, the blue books are Freud's complete works. And I looked at early Freud. Well, early Freud was a good, thoughtful trauma therapist. He really thought about it. He knew what he was doing.
Yeah.
He did a good job. And so
Mhm.
I learned from early Freud a lot about that. In fact, he was the first one who described memory reconsolidation. He described how when people told him about their traumatic experiences with affect, then some sort of transformation happened. What he didn't understand was the part about the disconfirming information that came from the relationship he had with his patient. And because he thought he was an objective scientist. Anyway, early Freud was very influential. And beyond that, I would say, it was some of the early mentors in my residency. And then um, I, I, if I had anything I would say to a young person, it would be learn about attachment and learn about development. Um,
Yes.
uh, Development is incredibly useful when I'm thinking about a little kid inventing a solution to a problem. I'm picturing, how tall they
Yes.
are,
Yes.
what age they are, what's going on in their head,
Yes.
how they think.
So
So
we often see the footprints and we imagine the figure in that footprint, like that classic figure from the
yeah.
Metropolitan Museum of Museum of Science. There's that
Mhm.
that classic picture of the two Neanderthals walking across the snow, and the footprints we reconstruct it in our mind.
Yes.
Many years of experience and many cases, we kind of can see the figures.
Yeah,
That's,
I love that metaphor. I tend to think about reverse engineering, I guess because I was a little bit of a nerd in when I was younger, but that's a lovely one.
mm,
Yes. Picturing is a lot of what makes us good therapists is being able to picture what was really going on.
Right.
Jennifer, is there anything that you want to ask in this?
No, I just want to thank you so much for spending this time, and I certainly learned a lot within this
Well,
hour. I appreciate it.
I love to talk. I came from my dad was a professor at Stanford,
Oh, really?
and
What did he teach?
he taught philosophy. So
Oh,
Of
I
course
stayed a
he
lot.
did.
I stayed far away from philosophy as far as I could, but little by little, I find myself thinking a lot
yeah,
about
yeah.
those kinds of principles. Yes.
Yeah.
Um, so it's hard to get me to shut up.
Well, you're here to teach and to explore, and that's what you were doing. That's great. So, where do you see the field going?
So I'm really the reason I'm involved with the American Psychiatric Association is hoping to keep psychiatrists at least having some appreciation of the mind and how it works. And I think that the therapy is going to grow across the world. The need is incredibly important,
Mhm.
and so my little piece is to try to help people be better therapists and do it with easier, more training that they can wrap their minds around more easily and make use of in a practical way. Um, so I just hope we see more and better therapists as things go on. Um, and I think, it's interesting to see what all is going on with AI and online therapy and things like that. But my own take on it is, I think human beings are incredibly good at picking out what is unique in another person and developing trust when the other person responds like a real human being. So I don't know if these magical solutions and easier methods are going to be able to substitute for us.
Yes.
I think some of the gurus of artificial intelligence, what was it? Bill Gates was saying the other day that he thinks that healthcare is one area where people aren't going to be put out of work by automation.
I, yeah, yeah. Well,
Yeah.
Dr. Jeffrey Smith, thank you so much for educating us and informing us and sharing your wisdom with us.
Okay.
It's
I
been
got
a
to
great.
put in a plug for Istanbul
Thank
too.
you. I
Okay.
will be getting information on that from Jeff.
Okay.